Today on Investigate TV Plus Weekend, families signing nursing home paperwork, later blindsided by lawsuits and massive debts.
It ripped open a deep wound, a grieving wound, and a wound of now financial responsibility for something that I didn't even know that I had.
Plus, month after month, people pay for health insurance, yet some still struggle to get the coverage they're promised.
It's like they make you do extra work that's gonna be wrong, that you don't know, so they don't have to pay you and they don't have to give their money away.
And medical credit cards showing up in patients' mailboxes, sometimes without their knowledge, and costly consequences.
I was devastated, and then the more I called trying to find out, to talk to somebody, hey, you can't do this, this is illegal. I heard from billing agents, this happens every day.
Investigate TV Plus Weekend starts right now. Hello and welcome to Investigate TV Plus Weekend. I'm Lee Zurich. A warning for any of you who may have a loved one in need of a nursing home. Our team found some of these facilities are aggressively pursuing family and friends of residents for their unpaid stays. It often involves paperwork signed during the admission process. Our Chris Nakamoto spoke to families left blindsided by bills and lawsuits as attorneys sound the alarm.
She was a great mom. She always made sure that we were always happy.
Elizabeth Bovenzi put her family first, which is why it was so difficult when her dementia progressed. The insidious disease forced her family to house her in a nursing home in Rochester, New York. Her daughter, Toni Cook, signed this agreement for her mom during her admission. The line where she signed her name reads resident or power of attorney, even though she was neither. Cook vividly remembers the conversations during that stressful process.
I wanted to read through them, which they pulled it right away and said, oh, no. You're not going to be responsible for anything. She came in, and when she was admitted, she came in with Medicaid and Medicare. And they assured me that her bills were going to be being paid by these two insurances.
Without hesitation, she signed those documents. Her mother lived for about 6 months until she died in November of 2024. Months later, her death delivered an unexplainable blow.
I went to the mailbox to get my mail sometime in May, and I had an $80,000 bill from the nursing home. Well, I called them and I told them that I was not responsible for her bills. A few months down the line after that, I got a process server knocking on my door, serving me with legal papers that I was being sued.
Unknown to Cook at the time, the documents she signed were used against her, with the nursing home saying her mom never applied for Medicaid. So Cook was on the hook for her mother's unpaid bills, with the total coming in at $170,000. Cook had to get lawyers to help, challenging the nursing home's lawsuit, saying the admissions agreement does not include language, making it clear that she would be held liable for her mom's finances. Her lawyers also fired back, saying this process is unenforceable under federal law, which bars third-party guarantees of payment as a condition of admission. Anna Anderson is a lawyer at the National Consumer Law Center.
The federal law bans nursing homes from pursuing other people for a resident's nursing home bills. But unfortunately, nursing homes have gotten cleverer and cleverer as they have sort of looked for ways to try to find someone to pay for these outstanding debts. And with each turn that the federal government takes to try to stop it, the nursing homes then take a new step and a new tactic to try to find a loophole or a workaround to try to make people responsible for these bills.
Anderson says some nursing homes are using language hidden in admissions agreements to get around the federal law that took effect in 1987, prohibiting the use of debt collection methods to go after third parties for their personal financial assets.
But I was really shocked and surprised when I started to get calls from people who were getting sued not for their own debt, but for their loved ones' nursing home bills.
Our national investigative team found these debt collection lawsuits are becoming increasingly common across America, well documented in states like New York, New Jersey, Indiana, Kentucky, Ohio, Alabama, Washington, D.C. In a single county in New York, 24 nursing homes filed 238 debt collection lawsuits, primarily targeting friends and family members of residents, seeking nearly $7.6 million between 2018 and 2021, according to the NCLC. In Alabama, a nursing home sued for $67,000 of debt, almost $80,000 in Ohio, nearly $120,000 in New Jersey. But it's hard to fully know the true extent of the problem because these cases are filed in local county courts with no central way to compile them.
It ripped open a deep wound, a grieving wound, and a wound of now financial responsibility for something that I didn't even know that I had.
No one knows the stress of possible financial ruin better than Lynn Marie Witt. Witt was willing to do anything for her mom, Joan Januszewski, who was admitted to a nursing home in New York as she courageously fought cancer. During this trying and stressful time, Witt says she felt compelled to also sign documents upon her mom's admission.
And I remember asking at the time, because I didn't understand what I was signing, I had said to her, does this make me responsible, financially responsible? Because at the time I was homeless and had a lot of issues, and of course I didn't want to take on financial responsibility. And she said, oh no, absolutely not, honey, it will be covered.
But the nursing home said those documents did, ultimately putting Witt on the hook for her mother's unpaid bills. Januszewski was only a resident for 23 days before she died. Following her mother's death,
I had been living in my car, what they call couch surfing. Yeah, not a good time in my life.
But years later, the facility found her new address, delivering her mother's unpaid debt in the form of a big bill, ultimately morphing into a lawsuit, $9,240 plus interest and attorney fees. Witt's case joins a growing number of Americans in a fight with nursing homes around the country, seeking repayment from third parties over paperwork they signed at the time of admission. Witt sought help from a free legal service to challenge the nursing home's lawsuit, demanding she pay money she didn't have.
The stress really impacted me physically, mentally, socially. I disappeared off the planet for a little while.
I thought I was gonna die. I honestly thought I was gonna just, and in some ways, it's like, well, if I'm not here, it's going to be better for my whole family. I mean, how do I leave my kids a $170,000 bill? It just eats at you. I'm thinking, do I have to claim bankruptcy? You know, what are my options? What are my choices?
The American Healthcare Association represents the majority of nursing homes in the country. They wouldn't do an interview, but told us these types of lawsuits are not common practice, and we're urging caution that highlighting it could be very misleading. In 2024, the National Consumer Law Center and Justice and Aging reported that more than half of elder care advocates in 27 states said they had seen lawsuits against third parties, with as many as 20 cases filed in their states.
We are seeing that people are just trying to do right by their loved ones, just trying to help them get into the nursing home care that they need. But at the end of the day, they are facing lawsuits that have huge financial consequences on them. And that should not be happening.
For Anna Anderson, there's nothing misleading about the awareness she's promoting.
If you sign one of these documents, even though there's a federal law that bans holding you responsible for the resident's debt, it could still mean that the nursing home is going to, down the line, try to sue you to try to collect those bills from you. And that's not some situation you want to find yourself in. So make sure you read the documents carefully.
And that's what they do. They bully you and you get scared. And that's what my attorney said. A lot of families just settled.
With sorrow shifting to anger, Witt received a bit of good news at the end of our interview.
Paperwork showing that this is completely over for you.
Wow.
That
It's like mine will sign off?
yeah, all files at the court now, but then you'll have that documentation.
Thank goodness.
Neither nursing home's attorney responded to our request for comment. In both cases, the facilities dropped their lawsuits after Cook and Witt received legal help. The nursing home dropped the case against Witt due to her financial hardship, and the lawsuit against Cook was dismissed after Medicaid applications were filed. Since both were dismissed, no court ever addressed whether the daughters could be held responsible for their mother's debt.
That's an entire month's worth of groceries. That's a car payment. That's almost more than half of our mortgage. It's our bills. It's everything.
Coming up, denied claims, missing codes, and endless back and forth. One mom's fight exposes just how confusing insurance paperwork can be. You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes. We count on health insurance to be there when we need it most, but sometimes claims get denied not because of medical reasons, but because of complex paperwork. Investigative reporter Cassidy Williams in Connecticut shows what one new mom went through and what you can do if it happens to you.
Come here, let's do the puzzle together.
Toddler Layla Nielsen has a big personality.
Thank you.
But that big personality started out as a 3-pound preemie.
She was a peanut. Definitely a life-changing event to have a NICU baby.
After more than 50 days in the NICU, Layla came home. On doctor's orders, her mom, Kelly, fed Layla a special neonatal formula.
It was scary. It was regimented. I'm a first-time brand new mom, so I'm like, oh my God, what do I just have this peanut of a baby, and I'm gonna follow everything that I'm told to the T.
Neonatal formula isn't cheap, but it can be covered by insurance.
You name it, I kept it.
Nielsen kept all her receipts and submitted a claim to be reimbursed for around $600 worth of formula. But months later, it was denied.
The lady said, you didn't fill out the form right, you missed an NPI, some doctor code number that the pediatrician knew.
NPI stands for National Provider Identifier. It's a unique code that connects a claim with the doctor.
So it can be very complicated to fill out the forms, but what's really important is to try to fill out as much information as possible to avoid getting the claim rejected.
Kathy Holt is Connecticut's acting healthcare advocate. Her office helps people in the state work through insurance denials and appeals for free. It's a resource Nielsen wishes she knew about.
Oh, you're a monster?
Holt says 65% of calls to the Office of the Healthcare Advocate are about denials. 40% are denials for medical necessity. The other 25% are administrative denials, or what she calls connecting the dot cases. Think of filling out a healthcare form like a game of connect the dots. If you miss even one dot along the way, like an NPI number, you could be denied, and the burden is on you to figure out what dot you missed.
The complexity of insurance and the quickness to deny services rather than to fix the problem that may have arisen, the box that wasn't checked, or the signature that wasn't obtained, those sometimes take a little while to uncover.
What do we got? Oh, headphones and music?
Like Layla's matching game.
Headphones and music? Good job. High five.
Kelly Nielsen tried to connect what her forms were missing on her own.
How much time do you think you spent on the phone, sending emails, filling out forms?
At least two days.
But she kept getting denied.
I think in total I was denied 3 or 4 times. And it's like they make you do extra work that's gonna be wrong, that you don't know, so they don't have to pay you and they don't have to give their money away.
When we asked Nielsen's insurance provider, Anthem Blue Cross Blue Shield, to find out what happened, they explained in a statement that the first time the claim was missing the prescription and a diagnosis code, and went on to say, "We understand the back and forth with the member caused confusion and ultimately resulted in no action being taken. We sincerely apologize for that mistake. We have now contacted Layla's provider to obtain the necessary information, and we have approved the claim for the formula."
That's an entire month's worth of groceries. That's a car payment. That's almost more than half of our mortgage. It's our bills. It's everything.
Hey, look, I found the butterfly.
The money is now on its way back to Nielsen. The game of connect the dots finally complete.
Good job, baby.
If you need help with an insurance denial, many states have consumer assistance programs known as CAPS. To see if your state does and how to contact them, start at the Consumer Assistance Program page, which you can access by scanning the QR code on your screen. If your state doesn't have a CAP, that site will direct you to other resources, including your state's Department of Insurance or the U.S. Department of Labor.
I got a hit on my credit saying somebody did a hard look at my credit. And of course I was freaking out, like, what is going on?
Up next, a school teacher went to the ER with a bill she couldn't pay in full, but instead of a payment plan, she says she ended up with a credit card she never asked for. Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms. Medical debt is a growing burden for millions of Americans, and now a new practice is raising concerns: patients being signed up for medical credit cards without their consent. One school teacher says it happened to her, and the impact hit her credit score. Reporter Susan Campbell shows how it happened and what you need to watch for.
It's an old vintage.
Carrie Morgan is house hunting, getting ready for a move to Texas.
Now with the credit hit, I'm probably postponed a few more months.
To understand that credit hit, we have to go back to January. Carrie went to the ER.
They said it was $700 and something odd. And I said, well, I don't have that. Can I be on a payment plan? They said, sure, let me take a look. They came back with like $30 a month. And I said, okay, perfect. They said, you should get an email.
A couple days later, she got an alert.
I got a hit on my credit saying somebody did a hard look at my credit. And of course I was freaking out, like, what is going on? And come to find out, it was Banner ran my credit and signed me up for a credit card to put the payments on.
Then a credit card showed up in the mail. Carrie says she never asked for this and never signed anything.
Not a thing. I'm infuriated.
On its website, Banner Health touts its relationship with a vendor that offers credit.
We are starting to see them marketed in more and more healthcare settings.
Patricia Kelmar is the healthcare director for the Arizona PERG Education Fund. She says medical credit cards could be really costly for consumers.
Oftentimes, they have a zero interest introductory rate, is what they call it. But the interest is significantly higher than you would see on a regular credit card. And if you miss a payment or don't pay it off, the full balance, in a certain period of time, the interest is retroactive.
There's another potential problem if you use a medical credit card.
Now you owe the money to a bank, not to the provider. The provider's been fully paid. If you find out that you were misbilled, now the argument is not with your provider anymore. You've lost that ability to fix that error.
Unlike Carrie, a 2023 report by the Consumer Financial Protection Bureau shows patients report being signed up without their consent or knowledge.
Our healthcare professionals should not be marketing financial products to us in the healthcare setting. It's just a bad idea.
Carrie says in her case that unwanted and entirely unexpected credit card dinged her credit score by 16 points.
I was devastated. And then the more I called trying to find out, like, to talk to somebody, hey, you can't do this. This is illegal. I heard from billing agents, this happens every day.
When we asked if this is a known issue affecting more people than Carrie, a spokesperson emailed us a statement saying Banner Health takes these concerns seriously. As a matter of policy, we do not discuss patient matters publicly.
Shake?
But Carrie told us after we reached out, the hospital wiped out an $814 bill and discounted another bill by 50%. Cure, the company that issued the card, also told us it will reverse that hard inquiry on Carrie's credit.
Look at the trees.
Now she can get back to her house hunt.
If you're facing a medical bill you can't pay in full, here are 3 things you need to know. First, you may be able to set up a payment plan directly through the healthcare provider. Second, ask for everything in writing so there are no surprises. And third, ask for time to consider your options before you agree to anything.
People just need to be more discerning and not be so fixated on price.
After the break, the price may be right, but is the product safe? A new report shows online shopping is putting more dangerous and recalled products in our homes. We show you how to spot the red flags before you click buy. You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download. Online shopping is more popular than ever, and so are the risks. Injuries from recalled products climbed to an 8-year high in 2024, according to the U.S. Public Interest Research Group. Our Carice Jackman explains how to shop smarter and avoid hazardous products in this week's Watching Your Wallet.
Teresa Murray, consumer watchdog with the U.S. Public Interest Research Group, or PIRG, closely tracks product safety and recalls.
People just need to be more discerning and not be so fixated on price.
The group's latest Safe at Home report identified 869 injuries linked to recalled products in 2024, the highest in 8 years. Despite fewer consumer protections, it's estimated that more than 40% of clothing purchases happen online, along with 17% of consumer electronics and 14% of toys and children's products.
One of the things that we found in our most recent research, products that are sold online were twice as likely to have violated a testable federal standard, like the easy stuff. We're not talking about, oh, this thing that breaks, because sometimes things break.
Murray says before you buy, especially children's products or electronics, take a minute to check for recalls at cpsc.gov/recalls and look for complaints at saferproducts.gov. She recommends sticking with sellers you know or authorized retailers listed on the brand's website. Read reviews carefully and make sure the seller has a U.S. address and working phone number. Watch for red flags like long shipping times or a website that looks suspicious. And be alert for fake reviews. Murray says nearly identical comments, unverified purchases, or over-the-top praise can be a tip-off. If you think you've bought a counterfeit, check the packaging and labels, verify the serial or UPC codes, and report it to the CPSC or FTC.
There's more to life than just getting a good deal, especially if it's something that breaks right away or it causes an injury.
Murray also recommends checking toys both when they're new and over time for wear and tear. She says loose pieces or parts that could break off and be swallowed aren't just a choking hazard, they can also cause serious injuries. And that's it for us. Thanks for joining us here on Investigate TV Plus Weekend.